Colonel Michelle Thompson, the Director of the Department of Defense Food Analysis and Diagnostic Laboratory, is a boarded veterinary anatomic pathologist with an interest in zoo, exotic and wildlife pathology. She graduated magna cum laude from Texas A&M University College of Veterinary Medicine, where she was selected as the recipient of the Health Professions Scholarship Program. Colonel Thompson has served in many leadership roles, including Chief of Veterinary Anatomic Pathology, Brooks City Base, Chief of Veterinary Pathology, 59th Clinical Research Division, Joint Base San Antonio, Lackland, and Chief of Veterinary Pathology Services for the Veterinary Science Branch of the 711th Bioeffects Division at Joint Base San Antonio, to name a few. We are pleased to share with you an overview by Colonel Michelle Thompson as she gives a presentation of U.S. Army Public Health Research and Surveillance.
Good afternoon. I'm Colonel Michelle Thompson, the current director of the Department of Defense Food Analysis and Diagnostic Laboratory, and I am honored to have been invited to speak about who we are and what it is exactly that we do. I've been in this position since March of last year, so essentially I arrived as everything was shutting down due to the pandemic. And while the op tempo for many organizations has decreased during this time, the DoD FADL's op tempo has steadily increased and continues to do so. In fact, I like to refer to what our team has accomplished in the past 12 months as our own little internal Operation Warp Speed, and I will elaborate on that further in this brief. While we are not a research laboratory per se, we do often collaborate on research projects with other organizations and agencies. Many GEIS projects have run through our lab, specifically vector-borne diseases, Chagas disease being one of the main areas of focus. GEIS also funded the startup funds for us to add SARS-CoV-2 diagnostic testing capability for military working dogs. Additionally, we also maintain the military working dog or MWD serum repository. So we often have PIs come through our lab and pull those to conduct retrospective studies. That being said, my purpose today is to increase awareness of our existence. Okay, it's often a true gem that's often overlooked. As public health professionals, we're often on the sidelines, quietly surveilling for those threats that we cannot see. And so we often are in the forefront until there's a foodborne illness outbreak or a new emerging infectious disease of public health significance. Additionally, today, I want to inform you about all of the lab's unique capabilities and how we utilize these capabilities to support the DoD and other agencies worldwide. I've listed a brief agenda. I'm going to start with a brief overview of the FADL to include our vision statement, our mission, and our organizational structure. I will go into some of our collaborators and the work we've done with each of them. I will touch on the cholinesterase reference laboratory, or CRL. Additionally, I will also discuss the cholinesterase monitoring program, or CMP. I will also cover each of the 6 laboratory sections that make up the FADL as a whole. Then I'll touch on current initiatives we're working on, end with a summary, and leave time for any comments and or questions. Our vision statement is to remain the Department of Defense premier global One Health laboratory, ready to provide innovative, adaptive, timely, and accurate testing of food, water, and diagnostic submissions through a highly efficient and accredited institution now and in the future. And when I refer to diagnostic submissions, I am talking about clinical or human specimens as well as animal diagnostic specimens. The FADL is truly the premier DoD laboratory for food safety testing and zoonotic disease surveillance, as well as testing for the DoD cholinesterase monitoring program. Our mission is to provide radiological, microbiological, chemical, and toxicological analysis of subsistence and bottled water, molecular and immunologic testing of human, animal, and entomologic specimens, cholinesterase monitoring and technical consultation to the DoD and other federal agencies, ensuring chemical surety, food protection, and contractual compliance while supporting public health related surveillance and diagnosis of zoonotic diseases, as well as any emerging infectious diseases of public health significance. We are constantly monitoring for zoonotic and emerging infectious diseases, food and water contamination, and environmental hazards that may negatively impact forest health and availability, thereby ultimately leading to mission failure. We also actively participate in any and all opportunities to educate our customers and stakeholders. Over this past year, with the pandemic challenges, we have continued to host multiple MS Team seminars on topics to include FAVEN submission guidelines, food submission guidelines, and we are actively engaged in the U.S. Army Medical Center of Excellence Surveillance Food Program course. And we provide proficiency tests for those that graduate from this course, enabling them to maintain their subsistence testing skills. We are truly, truly the tip of the spear when it comes to forest health protection. We currently serve customers in over 47 states and 18 countries. As far as organizational structure, I'm not going to go into deep detail here, but wanted you to see that we are comprised of 6 separate lab sections that fall under the directorate. Our deputy of field operations is in constant communication with our customers with regards to the food protection piece and what capabilities are needed in the field, while our deputy director of laboratory operations oversees the diagnostic side of the house. So 6 sections total. Quality assurance is critical for maintaining our accreditation status and is comprised of 1 green suitor and 2 DA civilians. The cholinesterase reference laboratory, okay, so this is one of our clinical assays that we run in the FADL, is comprised of primarily green suitors and 1 DA civilian. Our chemistry section is all civilian. Our diagnostic section is composed, it's split into our immunodiagnostic section and molecular diagnostic section. And it's comprised of 2 green suitors, and the rest are either DA, NAF, or contractors. Our microbiology section is a mix of green suitors and civilians, and field tech support is all civilians. And I'll go into each section more specifically as we proceed through this presentation. Okay, so some, but absolutely not all, agencies and organizations that we collaborate are listed on this slide. We collaborated with APHC Public Health Lab Directorate when standing up our SARS-CoV-2 pooled surveillance testing capability for service members. We continually have for many years and continue to assist the Medical Center of Excellence with their surveillance food lab course. This program, the surveillance food lab program, was initially initiated to develop different field tests that could provide military personnel with more rapid results, right, than the fixed reference labs could, right? Some food items are perishable, or transport times would render the samples non-testable when they arrive to the lab. So this was initiated to kind of mitigate those issues. In addition, we will provide tours for BOLIC and any other students going through the schoolhouse to increase their awareness of what we do and what we can do for them. We have also worked with USAMRIID, worked extensively with them in standing up our capability to perform SARS-CoV-2 diagnostic testing in animals, as well as DHA Vet Services and USDA APHIS National Veterinary Service Lab, all big players in that effort. We have also, I think I skipped over CDID, the Capability Development and Integration Directorate. We actually have a space set aside, a lab space set aside within the FADL that houses training platforms that are deployed to the field for testing food and water that those warrant officers or VCOs, veterinary corps officers that are going to use the equipment can train on. Some examples of those platforms include the BioFire or the mesoscale toxin identifier. As far as NATIC, we were in discussions with them and the 59th Medical Wing regarding the potential use of CIMR or continuous infectious microbial reduction technology. And I'll go into that a little bit in more detail later in the presentation. Our clients, by far, veterinary services makes up the bulk of them. In addition, PrevMed, entomological sciences, chemical surety program partners, and lab animal research facilities are all big clients for us. And then again, listed on the far right, you can see the services that are provided to include immunodiagnostic assays, molecular diagnostics, chemical analyses, microbiological analyses, chemical surety for those personnel working with nerve agents. We are absolutely always happy to provide any consultation and or education opportunities, and then field technical support, which is they're kind of the liaison between our customers and each of the lab sections themselves. Okay, as far as the cholinesterase reference laboratory, or CRL, it is essentially one laboratory that runs one test for two separate missions. So the test that they run is the red blood cell acetylcholinesterase assay, which is measuring the enzymatic function of acetylcholinesterase in erythrocytes. Okay, because the subtype in erythrocytes is very similar to that which is found in the nervous system and skeletal muscle. So if you have decreased activity in your erythrocytes, you would expect a decrease systemically. So it's essentially a red flag test that's used to notify providers and managers that their employee is potentially being exposed to a nerve agent beyond recommended ranges. Okay, with that flag being set well below the level where one would expect to see obvious clinical signs. So the CRL, or the cholinesterase reference laboratory, is the primary testing site for those organizations listed on the right. And then it conducts quality assurance, okay, or the cholinesterase monitoring program for the 6 remote labs listed on the left. Okay, we provide all their proficiency testing materials, and our staff travels out to those sites to make sure they're in compliance with all federal regulations when running these assays. Additionally, we're currently serving as the primary testing site for the Bluegrass Chemical Agent Destruction Pilot Plant, or BGCAP. Okay, this is a $1 billion program that began the destruction of chemical weapons stockpiled at the Bluegrass, Kentucky depot in January of this year. So what the CRL CMP is doing is supporting the Army Chemical Surety Program by ensuring any operation that involves nerve agents, okay, and we're primarily talking about demilitarization sites here, making sure that they're conducted in a safe and secure manner. Field technical support. This is where all of our samples are received, with the exception of our COVID samples. Those are kept completely separate from everything else and received it as separate doc entirely. But everything else is received here, where they maintain a chain of custody, store any samples they need to, and ultimately report after being input into LIMS, or our laboratory information management system. Okay. And they also ensure that each specimen is distributed to its respective section for processing. Okay, microbiology and our chemistry section um, are involved with forest health protection with regards to subsistence. 70% approximately of their workload comes from the destination monitoring program. This program was established to provide surveillance capability by specifically targeting higher risk food items through product lab sampling. So this is where your food inspector or your 68 Romeo is pulling random high risk food items from the commissary or shopette, and they're submitting those samples to us for testing. An example of surveillance would be testing samples from a totally new source. For example, that would be the caterers that we inspected for the R North units that were deployed to COVID 19 hotspots earlier in the year. Commercial sanitary audit samples also come to us. For those of you that aren't aware, all subsistence provided to the DoD must come from an approved source to ensure their safety. So, approved sources are those facilities or plants that have demonstrated excellent food protection practices. So, we're always out there, inspecting them. With regards to food and water risk assessments, an example of this would be inspecting a hotel or restaurant that commanders or service members may want to use for a military event or a military exercise that's being held far outside of an urban area, right? They're out in the middle of nowhere. So we perform these food water risk assessments from where they're procuring their food locally, communicate those findings to commanders and service members that are going to be encountering this high risk local food, with the intent to mitigate any incidents or impact of foodborne illness. We will also, again, we will always test any unapproved sources and any cases of suspected foodborne illness. So, the FADL does maintain its status as a legitimate force multiplier by ensuring a safe and wholesome food supply. So, for each food category, for example, raw meats versus raw fish versus cheeses, there are specific not to exceed limits. For example, the not to exceed limit for histamine in fish is 50 parts per million. If our sample exceeded 50, we would list that as a nonconformance or report that out as a nonconformance. We reported approximately 197 of these between FY 17 and 19, with 53% of those samples submitted as part of the destination monitoring program, 33% taken during routine sanitary audits, and the rest were samples submitted that were associated with suspected foodborne illness and surveillance. Additionally, we also help DoD research facilities that are conducting live animal research maintain their American Association for Accreditation of Laboratory Animal Care, or ALAC accreditation rather, by testing any feed, bedding, and water used at that facility. Our diagnostics section has by far been the most busy section over the past 12 months, as you can imagine. They're involved in forest health protection by surveillance and testing for zoonotic diseases, as well as diseases of public health significance in humans, animals, vectors, and sometimes food. The FAVN, the fluorescent antibody viral neutralization assay, is a huge part of their workload. Okay, this test has to be performed for all pets prior to PCS to determine their rabies antibodies titer and to make sure that they are good to go. They also perform the RIFIT test, okay, the rapid fluorescent focus inhibition test. This is our second clinical assay performed at the FADL at this time. So this is done for any government personnel that have been vaccinated for rabies or they have been potentially exposed to rabies via a bite from a rabid animal. So also very important. Again, as I alluded to before, we maintain the military working dog serum repository with serum banked since 1993. These are utilized in research protocols that are approved by the DoD Military Working Dog Vet Services or the Dog Center out at Lackland. These dogs do deploy and they absolutely can be sentinels for what service members are potentially exposed to while downrange. So all these assays were kind of overshadowed this year by the request to perform SARS-CoV-2 pooled surveillance testing in humans and diagnostic testing in military working dogs and privately owned animals of eligible beneficiaries. Last, but certainly not least, I mean, perhaps the most critical section within the FADL is our quality assurance section. The DoD FADL is an ISO 17025 CLIP and ISO 159 accredited first class lab and remains the DoD flagship food analysis and diagnostic laboratory. For those of you that aren't familiar with these, ISO 17025 is an accreditation based on a standard that's published by the International Organization for Standardization. And it's looking at the general requirements for the competence of testing and calibration labs. And so, why do we even care? And why is this even important? This accreditation actually enables labs to demonstrate or show that they operate competently and that they generate valid results. Therefore, promoting confidence in their work, not only nationally, but around the world. Furthermore, our results have to be admissible, right? And be upheld in a court of law. Okay. Because if we have a facility where we find a nonconformance, we can potentially, shut them down for a time period or put a product on hold, costing them millions of dollars potentially. So very important. CLIP, or Clinical Laboratory Improvement Program, is the DoD's version of CLIA, or the Clinical Laboratory Improvement Amendments for laboratories performing clinical assays. Again, currently at the DoD FADL, we perform two. That's the RIFIT and the red blood cell acetylcholinesterase assay. ISO 15189 then specifies requirements for quality and competence specifically in medical laboratories. This is a much more stringent standard than either ISO 17025 or CLIP. So it's essentially raising the bar quite a bit. Again, very important. We don't want to misreport any patient results. They also investigate any non-conforming processes, find preventative and corrective actions and ways to mitigate any issues. They evaluate our proficiency program, which is very rigorous for each assay listed on our scope of accreditation, whether it's biological, chemical, or clinical scope. They also maintain a document control system. As far as professional lab networks and working groups, the DoD FADL is an active member of the Food Emergency Response Network, or FERN. This allows our lab, in the event of a national food emergency, to provide support, given that we have the bandwidth to do so at the time. Additionally, our subject matter experts, by being active members, have access to quality training programs that are offered via the FERN. We are not currently active members of the National Animal Health Lab Network. Excuse me. We have been in the past. We're working to reactivate that. Members of this group respond to animal issues of public health concern, such as COVID-19, in a coordinated response with other members of the network. So we're working that to reactivate that. The FADL runs the laboratory working group, whose purpose is to provide expert guidance to the DHA Food Risk Evaluation Committee, or FREC, on evaluation of critical chemical and microbial limits on food products, recommendations for new lab tests for subsistence, as well as the evaluation of the relevancy of current methods. And the FREC, then, or the Food Risk Evaluation Committee, is a joint DoD advisory group that provides guidance to the Chief DHA Vet Services, as well as the Surgeons General of the military medical departments, on all matters that relate to food safety and defense. Two topics that were brought before the FREC this past year were whether or not we should be testing for CBD or THC in their analytes in food products, as well as whether or not we should be testing for per and polyfluoroalkyl substances, or what are known as forever chemicals, in bottled water. And I already mentioned how we participate in the schoolhouse's surveillance food laboratory program. Current initiatives. So SARS-CoV-2 testing is kind of what we've been sleeping, eating, and breathing for the past 12 months. The DoD FADL is actually involved in the fight against COVID-19 since the onset of the pandemic. Initially, we supported BAMC's molecular diagnostic laboratory with manpower for diagnostic testing, as well as asymptomatic screening. We now have stood up our low throughput SARS-CoV-2 pooled surveillance testing capability, and those listed underneath are collaborators in that effort. We have also gone live as of 23 March with our SARS-CoV-2 diagnostic testing in military working dogs and privately owned animals. Again, this was a huge effort with those listed below. The testing criteria for animals remain extremely stringent. The animal has to have come from a household with a confirmed positive human in the house. They also must be exhibiting clinical signs and symptoms of COVID-19. And finally, all other more common respiratory diseases must have been ruled out. At this time, we are only providing that testing for canines. We are expanding to felines here in the near future, as they appear to be the most susceptible. And here before you, you see our COVID-19 Dream Team. Again, this was just a huge effort to have added 3 different SARS-CoV-2 assays to our scope of accreditation in less than a year is tremendous. And that's why I like to tell them they've performed their own little Operation Warp Speed. Again, our low throughput platform on the ABI 7500s is ready to go for pooled surveillance testing of service members. We are very close to completing validation and verification of that assay on our Hologic Panther Fusion platform. So very, very excited about that as well. Up and coming and in current discussions, our next step, we are going to set up military working dog surveillance testing. So we are standing up the capability for SARS-CoV-2 antibody testing in animals. And of course, any positives that we may receive that are confirmed by USDA, APHIS, National Vet Lab Service, will be sequenced. We are also and have trained kilos that are about to deploy to conduct COVID-19 testing downrange. They've run through our lab and we've trained them up on how to use the platforms that they will be using in the field. Throughout the pandemic, we have also provided expedited food testing. Specifically, early on, it was to our North units that were deployed to COVID-19 CONUS hotspots in New Orleans, Seattle, and Dallas, to include the 1st Med Brigade, 62nd Med Brigade, and the 438th MDVSS. Currently, we've shifted to providing that same expedited food testing to those units deployed to vaccination sites. And really, really on the fringe, as far as SARS-CoV-2 environmental testing, we know that it is not transmitted from surfaces of food, right? That's thought to be like not very likely. However, we were talking with NATIC as well as 59th Medical Wing, a PI with them, regarding the use of this SIMR or continuous infectious microbial reduction technology. This unit actually emits very low percentages of hydrogen peroxide and is thought to decrease the microbial load to include some viruses. It has been used in mitigation efforts, mold mitigation efforts, in barracks and housing with some success. And there was talk about bringing 2 units to our facility and kind of using us as a test and evaluation platform. We have yet to see those units. Additionally, in our talks to the FREC, the Food Risk Evaluation Committee, we did let them know that AOAC has certified 3 test kits for detecting coronavirus on surfaces. Again, I think the intent of these test kits was to confirm that sanitation was complete rather than, for use on any food prep surfaces, because again, that is not thought to be a mode of transmission for COVID-19. In conclusion, the FADL Global One Health mission fully supports a medically ready force. In fact, we're a force multiplier. The FADL continually seeks reorganization to effectively respond to future challenges, at the forefront, of course, and most recent being COVID-19. The FADL is absolutely reformed in accordance to ISO 17025, ISO 15189, and CLIP accreditation requirements. We are proud to be the most highly accredited public health lab. And we're absolutely a relevant force health protection multiplier. I've listed for you the link to our webpage if you should need our services anytime in the future. We're kind of embedded in the APHC site. I have also listed my work email. Please feel free again to reach out if we can be of any help or use to any of you in the future. With that, that is all I have. Again, thank you for inviting me to speak, to increase awareness about what we can do for you. And that's all I have, pending any questions. Thank you.